tracing, including contact investigations and monitoring, are essential in our fight against COVID-19, as well as other communicable diseases, including measles, as evidenced by our recent outbreak. I urge everyone to do their part by wearing face masks, washing hands, physically distancing, staying home when ill, observing isolation and quarantine as directed, and participating in interviews with the health department if you are contacted. Today, I have our County Attorney, Tom Humbach, here with us, as well as two senior members of the Rockland County Department of Health, Maria Souto, Coordinator of Disease Control, and Kevin McKay, our lead epidemiologist. Maria will speak first and will discuss contact tracing, again, including contact investigations as well as monitoring with you. Kevin will then speak as well and will answer questions. Thank you. Maria?
Good afternoon. So when we talk about contact tracing, it's a word that is an umbrella that allows us to do different things within contact tracing. The first thing that happens is that we get reports either through the mail, electronically from physicians letting us know about positive COVID patients. When we get those, we start our investigation. The staff begins to question patients, where they've been, what their symptoms are, how do they think they received it. And once we've gone through everything, we then, at the end of that, start really talking about the contacts. Who have you been with? Where have you been the 2 days before you started having symptoms or before you got tested? How many people were there? Were people wearing masks? Were you social distancing? And that's what we find out, who the contacts are. Once those contacts are found, we then let them know that they will be followed for 14 days by the staff. It could either be our staff or the staff that the state has, the virtual staff that the state has hired to assist us with the contacts. And these contacts are supposed to stay home. And I say supposed to because not always do they are forthcoming, but the majority of the people have been very good here in Rockland. And they stay home for 14 days, and we monitor them. We're making sure they're not having symptoms, because since they were exposed to somebody that had symptoms, we have to make sure that they do not have symptoms. And within those 14 days, we make sure everybody in the household is fine. We also make sure that they don't, and no necessities are needed, like food. Can they pay their rent? Because if we're telling them they can't go to work, there's a lot of things, there's a lot of social issues attached to this. So we try to keep it all around and do as best we can to keep the people safe, and also to make sure that they're not going to lose their home or going to not have enough food for their family. The contact tracing, like I said, is 14 days from the moment they are exposed. We start counting the next day. So like I said before, contact tracing is a process. It's not just one thing. It's literally spending pretty much anywhere from up to 2 hours on one patient, just trying to figure out where they've been and what they've done. So it's a very broad term, but it does have a lot of parts to it. So that's it.
Could you tell us about any instances that you encountered that people were not cooperative? What was that experience like?
It's not the first time. Diseases are, infections are things that people don't always want to talk about. And we do our best to try to explain to them the necessity of them talking to us and giving us that information. And usually we can get them to talk to us and give us some information that will assist us in finding the people that were exposed. It's not, we don't get angry with them, we don't get upset with them. We try to convince them, we try to explain to them that it's the best for the community. It's also the best for their family, to make sure that nobody's ill and that we don't continue propagating this disease, this virus, which is in our case the COVID-19.
Before, if you can hold the questions till the end,
Yeah,
I'd like to introduce our Director of Epidemiology.
It kind of makes sense because she's up there, unless you want her to
There'll be a number of questions, so I just want to get through the additional speaker. Thank you.
Hello. So I'm Kevin. I'm the epidemiologist for Rockland County.
Can you say and spell your name, Kevin?
Kevin McKay, Kevinmckay. I just want to follow up with what Maria said about contact tracing. Currently in Rockland, our numbers have been pretty steady. They've been rather low. In the teens, right, roughly between 10 and 20 new cases per day, which we've been following up on. And really the message today is that social distancing and wearing masks and following all the right protocols that are in place that we have right now are really helping our efforts, because wearing the mask and being socially distanced from others actually eliminates the fact of being a contact to somebody. So the more people abide by those guidelines that we put out, the less likely they are to become in contact with a case, and it helps us down the road to prevent cases. The goal of contact tracing is to interrupt transmission. So when we find out about someone, we want to quarantine them, make sure they're okay, and at the same time make sure that they don't infect anyone else. So really that's the point of contact tracing that I wanted to cover with you all today. And really that, when we call, we understand people don't want to give us a lot of information sometimes, but the more that they can give us about where they've been and where, who they've been in contact with, the better chances we have of slowing the disease and actually preventing more infection. So really it's just a plea to the residents of Rockland and New York, or anywhere in the U.S., who, if they are contacted by the health department, to really give us the information you have. It's just to help the greater good. So that's it for me.
Okay. We'll now take questions from whoever you like.
Is everyone associated with that Parktown cluster announcement cooperating now, all the party goers, or is there still any pushback that you're seeing?
No, everybody cooperated. It was became a very easy process, and we spoke, and they understood. Once we explained to them the reason, exactly what Kevin just said to you, that we'll be able to work with others and actually protect the community by them speaking to us. So they understood, and I asked them to be our ambassadors to their friends, because I think the youth is, says nothing's going to happen, but things are happening. So they were willing to talk, and so
and
we,
even those people outside the subpoenas too, right? Those other party goers, everyone's been good?
everybody's been good, yeah, absolutely. Anybody who's in contact, yep, everybody has been cooperating.
Have you seen any cases that have come from that cluster? Any additional cases removed?
No, none.
How about those people who say, legally, I don't have to cooperate, and there's some pushback, it's my right, HIPAA, I don't have to tell you. What can you tell those people that,
Well, we try to be logical, and we try to be have them understand. We try to answer questions for them. We also tell them, if you have somebody in your family that would like to speak to us, we're willing to explain to them why. Yes, they're right. It's voluntary usually, but it's a world pandemic, and it's hit everybody, and it's affecting everybody. And at this point, we as a world, as a people, have to work together for this to go away. And I think that's the message. Kevin, I think, put it beautifully, that we're going to stop it if we just do the social distancing. Even if you're going to get together with your friends, social distance, wear a mask, wash your hands, protect each other. So it's up to each individual to make this go away. We can't do it for them. We have to do it as a group, as a family.
Those that were refusing, what were they saying to the contact tracers when they denied them?
They just said they refused, and we took it down. They take it, and then they come to us, and we talk about it, and that's when we make our decisions, and we go to the commissioner.
How did the subpoena process work?
How does it work?
The subpoena process, how did that whole thing work? Who told who to subpoena them?
I speak to the commissioner. Kevin and I went with the commissioner. We reviewed the cases, and then the commissioner goes to our county attorneys, and the decision is made at that level, sir.
And Tom, could you address
Yes,
the public health law that we're operating under as part of this?
Yeah, just say your name for identification purposes, please.
Thomas Humbach, County Attorney.
We'll have her.
Pursuant to the public health law, section 2100, 2100, the Commissioner of Health has a duty to both find and control contagious diseases like COVID. And under section 309, she has the authority to give subpoenas. It's an important part of slowing down or stopping this disease to warn people that they may have been exposed and that they may want to quarantine. It's a confidential process. Even if the first person is contacted and gives the names of other people. When the other people are contacted, the name of the first person is not given. It's just you may have been exposed, and you may want to take some care or whatever other advice the health department might give. That's the basics.
Let me ask you a single question. If I get COVID and I refuse to cooperate, could I be liable for criminal prosecution when I infect someone else?
That's something that's more like legal advice.
But
You'd have to
under the law.
ask the district attorney that.
Okay.
How many contact tracers are there in Rockland?
Question for somebody else.
Okay.
So we have a number of contact tracers right within our department. We have less than 2 dozen who do this more on a regular basis. And then in addition, we have the availability of over 300 contact tracers within the county, and we have tracers that are utilized from the state level as well. Sorry, let me take this off, sorry.
Sorry. How many people who have been contacted have finished the interviews or completed it? Or in another way, how many haven't completed the whole interview? If you have a percentage, how many people actually go and say, yes, I contacted, and they give you the information you need? Is there a percentage of how many complete the interview, or is that some?
Out of how many? I don't understand the question,
How
I'm
many
sorry.
contacts have you done, your department, so far since the beginning of the program?
Kevin, do you have that number? No.
Is there any place where we can
Thousands,
find?
yeah, he said thousands.
Is there any website? Like, I know there are other cities that have a website with the number of interviews.
We don't have those numbers at this point, so we wouldn't have put them on a site at this point.
So you don't know
We're still
how
in the
many-
midst of doing.
Do you know how many actually complete the interviews?
I don't have that number. Do you, Kevin? Completed?
Commissioner, for
Next
those,
question.
Commissioner, for those of us who were not here last week, tell us about this scenario where these people were at a house party, how you learned about it, and what did you do, what action did you take?
Okay, so let me explain first of all, that is over. That cluster was evaluated in full. When we did not get the responses that we needed, we met and I sent the subpoenas. They were responded to even before the time that they would have needed to have any enforcement action as a result. And we have all the information that we need. So we consider that over at this point. You can look back for the history of it, but I really don't want to discuss it further at this point. Thank you.
What kind of a signal does that send to other people thinking of cooperating or not cooperating?
Well, I would hope that they would look at that and realize the importance of cooperating, and that sometimes other stronger means need to be taken, and that most people don't want to do that. And if they understand the reason that we need the information, as Maria said, they're usually very cooperative.
Thank you.
Do you think 350 tracers are enough? Are you looking to hire more people?
We have what we need. Thank you. Anyone else?
Do you think last year's measles outbreak and all the press that was around that has helped Rocklanders understand the process, and do you think it's helped your health department gear up more quickly because you have such recent experience?
Yes, so there were lessons learned from what we did with the measles outbreak, that it was so recent in our county, within a few months then, of course, this pandemic began, was helpful, I think, for people to understand. But again, continued education is important. And as we're doing today, and I thank you all for coming so that we can further explain what we're doing and the reasons why. I want people to be clearer on what contact tracing is, what the investigations are like, what the monitoring is for, and the importance of that. So you all are all doing a service to us as a result of that. And you also did, by the way, back with measles. You were very attentive to what was needed. So I do think that the population of our county really did get the point of what we do during the measles outbreak, which I guess was sort of a practice for what we're doing now. What do you think, guys? Yeah, it was, I think, helpful to us as far as going through a lot of the motions of what we're doing now, this process.
Well,
All right.
Was the phased opening of businesses here in New York State helpful to you, or did it hinder you?
No, I think it was helpful. Yes, I think it was helpful. A slower, deliberate process where we could then identify cases as they came. And as Kevin mentioned, thankfully, we have not seen an uptick yet in our number of cases. We hope we don't, and we hope, again, people wear their masks and wear them appropriately, like I mentioned at the press conference last week, making sure that they wear it over their nose and over their mouth, at the same time, not hanging down at the chin. It doesn't help anybody then.
to be distanced, physically distanced from everyone else, at least by 6 feet. To stay home when they're sick, as a reminder to those who are in the phases, you know, returning to work at this point. If you don't feel well, and you know yourself, stay home. And if you have been exposed to, please pay attention to, you know, the phone calls when they come, so that we can help you to help us. Okay. Thank you very much. I appreciate it.
And we'll call that a wrap, everybody.
Okay.
Thank
Good
you.
day.